It's just a handout of the slides. Thanks for hanging in there for an after-lunch presentation. I'm happy to be here. This is the HDSA disclosure slide. I'm not giving any direct advice. This is general information, and I don't have any personal disclosures that are relevant. So let's first talk about employment rights. This is a little bit of alphabet soup. We are going to go into each of these in much more depth through the majority of the discussion. But I'm going to talk about GINA, which is the Genetic Information Non-Discrimination Act. This is an act that deals with employment and healthcare. I'm only going to really deal with the employment aspect in this talk. And it forbids discrimination on the basis of genetic information. And then there's the Americans with Disabilities Act, which has been around for much longer, which prohibits discrimination in employment and then also in public and other settings. And the Family Medical Leave Act, which provides some job-protected leave. And then we'll talk a little bit about the Equal Opportunity Employment Commission, which is the enforcer of law. So let's start by talking about GINA, the Genetic Information Non-Discrimination Act. So as I said, there's two main provisions of this law. One has to deals with employment and one deals with healthcare. Title II is the one that prohibits employment based upon genetic information. This is a relatively new law, became effective in 2011. It defines genetic information as a family history of disease, your own individual testing, the genetic testing of others in your family, including fetuses, the request for genetic services like testing or counseling, and participation in that. It does prohibit the use of that information for most aspects of employment, so hiring, promotion, firing, termination, discipline, that sort of thing. So employers can't treat you differently or less favorably because of genetic information. They can't request that you provide information. They can't require that you provide genetic information. And if they come across genetic information in the course of your work, that must be kept confidential. There are 6 exceptions built into GINA. So if an employer inadvertently comes across genetic information, that's obviously not something they're forbidden from doing because it was inadvertent. So if you're talking to your coworker about your family member's illness and your supervisor overhears that, of course that would not be prohibited because it was just inadvertent acquisition of the information. It also accepts information that was obtained as part of a voluntary health or wellness program. This one gets a little bit sticky sometimes for our group because sometimes there will be family history or genetic information that deals with some of the wellness programs, but often it's how it's asked. So if there's information about health for some of these incentive programs that companies might have for wellness, they really are supposed to state that you don't have to provide any genetic information. Then there's some information that they acquire sort of in the public. So if they happen to be see your face on the front of a walk brochure, they're not prohibited from seeing that information, but they also can't, sort of scour Facebook looking for what you're doing with HDSA or something. So it has to be this sort of inadvertent acquisition again. And then there's some less common things like toxic monitoring programs. Sometimes there's staff who might work in a lab and they're using their own DNA samples as controls. Things like this might be an exception. So let's go through a case study just to get it a little more interesting than it was. So Jane has an insurance plan that does cover genetic testing if you're going through pre-symptomatic testing. She goes through testing, and then after she gets her results, the insurance company requests the results of the genetic test prior to paying for the claim. What do you guys think? Is this okay under GINA based on the little bit you know, or does this sound a little bit squirrely? I get a thumbs down. I see a bunch of thumbs down. Yeah, they likely violated GINA because genetic testing was a covered service under the plan, and so they can't require that those results be known to pay. An employer health insurance plan offers some financial incentives for employees who fill out a certain assessment form. That assessment form doesn't have a direct question about genetics in any way, but the last question is sort of an open-ended. Is there anything else relevant to your health that you would like us to know or discuss with you? Do you think that that form is a violation of GINA? That one's a little tougher. We get a no. I heard a no. Anybody think yes? A lot of unsures. So because this question could prompt someone to disclose genetic information, the question really should be reworded to say that genetic information should not be provided in the answer to that question. All right, good work. So let's talk a little bit about ADA. So this is the Americans with Disabilities Act. This has been around for a good long time, and it applies to most employer settings. So unless you work for a very small company, it probably applies to you. There are some state laws that I wouldn't know for every state, but there are some state laws that may offer some additional protection. The Americans with Disabilities Act specifically forbids discrimination in employment, so hiring, firing, promotion, termination, layoffs, trainings, that kind of thing. Employees with a disability can request reasonable accommodations, and we're going to go into that much more. These are accommodations that would allow you to continue to perform your job, and sometimes they have to provide those accommodations even in the application process for a job. The ADA does not explicitly address genetic information, and it's mostly relevant to people who are symptomatic with a genetic condition. If they're pre-symptomatic, it falls more under GINA. Okay. There are some exceptions with the ADA. You still can be legally fired if you have a disability. And that would be situations like you can't perform the essential functions of your job. So the ADA does not require that the company rework your job description to remove essential functions of your job. Or if there's safety aspects of your job that you can't perform because of your condition, that would be an exception. And then there's certain jobs, like professional jobs with licensure, maybe, pilots or truck drivers or perhaps social workers. We might have some special rules under our licensing boards. The ADA, as I said, does not deal with unexpressed genetic conditions, so pre-symptomatic people would not fall under the ADA. And it does not protect workers from requirements where their job requires that medical information is known for job-related purposes consistent with the business. So entities that do discriminate on the basis of genetic predisposition are treating the individuals as having an impairment, and that would make the ADA apply. So I mentioned that if they're pre-symptomatic, it may not apply, but if they're regarded as potentially having a genetic predisposition, it may also apply under the ADA. So let's talk a lot more about reasonable accommodations. So what is a reasonable accommodation? This is an alteration to some function of your job that does not create a hardship for the employer itself. So what is a hardship? Costs gobs of money or creates more work for a different employee. And there's many things that could be considered a hardship, but those would be the most common. These reasonable accommodations are, to a certain degree, up to the discretion of the employer. And you may ask for a reasonable accommodation, and the employer may come back with something different. So it may not be exactly what you have chosen or asked for as accommodation that they deem essential to allow you to do your job. So there's many examples under the ADA of what are considered reasonable accommodations. The things you most likely think of are probably the physical changes to the environment. So, maybe they have a step and they need to build a ramp if you're in a wheelchair to be able to get into the building, or make the bathroom accessible, or do changes to the workstation. These are the sorts of things that people tend to think about, but there's also other aspects that can potentially come into play. So sometimes schedule changes or schedule flexibility, or flexibility in the location of work, allowing someone to work from home if that allows them to still complete their job. Sometimes their leave policies, so taking time off, can be an ADA accommodation, and I will talk more about that. So there's a number of examples under the ADA. It's important to know that sometimes a leave of absence might be considered a reasonable accommodation under the ADA. Those would be situations like if somebody's not eligible for FMLA leave, or they've used up their FMLA leave. So sometimes leave is even an example. So how do you request these leaves? So often the employee might go to the boss and say, I'm having trouble doing this, but there's not some magic word that you need to say. You don't need to say ADA. You don't need to say the word reasonable accommodation. You can just say, I'm having trouble completing this. And that really should trigger the employer to start this conversation with you. You don't need to even be the one to notice. So an employer might come to you and say, you know, I noticed that your attendance is down, or you're, you know, really fatigued, or, you know, whatever it is that they might notice about your work. And that could even trigger a discussion of reasonable accommodations. So what is not a reasonable accommodation is changing your productivity goals, or eliminating aspects that are essential functions of the job, changing supervisors because you can't get along with the one you have. That's not a reasonable accommodation necessarily, or anything that would cause an undue hardship. So I looked into this study that was done by an organization called the Job Accommodation Network, which I will talk more about them, but they're a fantastic resource. So they did kind of a look at what are these accommodations, what are they costing people, what kind of hardships and this kind of thing. They found that 57% of accommodations required no cost at all to the employer. So that's a big chunk. So if the employer is afraid of the actual cost of the accommodation, this appears to be less of a concern. Of the rest of the group, a third that incurred a cost, that cost was a one-time cost under $500. And 4% said that there was an ongoing cost to the company. So for most companies, they're probably worried about the financial aspect of these accommodations, but research looks like that is an undue worry for most cases. So talking about these essential job functions, I've been in my position a long time. I haven't read my job description in a very long time, but probably in my job description, there is a list of things that are considered the essential functions of the job, and then maybe there's a list of things that are, you know, other duties as assigned kind of things. So sometimes even within the essential job function, there may be some tasks that are more marginal, and maybe those things could be swapped out with something else or eliminated, and so that the employer might be willing to do that. If it is an essential function of the job, then you go to what accommodation could be tried in order to make this job successful. Could the employee be reassigned to another position for which they're qualified? This is typically considered an accommodation of last resort. You should be trying to preserve your own job. Really, I can't emphasize this enough. The time to begin these conversations with your employer is when you start experiencing difficulties with work, not when you're already really struggling. The worst thing that can happen is they let you go because they don't know that you're having a problem. They haven't observed it, you haven't said it, you're struggling, you're working twice as hard to do the same job you always did, and they end up letting you go. And then you lose benefits, you know, long-term disability, short-term disability, other things. So start early. The ADA has what they call the interactive process. It's a multi-step process where the employer and the employee work together to come up with these accommodations. Employees must cooperate in this process. If you don't cooperate in this process, they don't have to provide these accommodations. And so if you say, I'm not going to provide medical information for you to do this accommodation request, they can just deny the process to you. The employer may ask you to sign a release of information form with your physician. It's often fairly limited, so they're not going to get your whole medical records, but very specific records related to your ability to do your job. That's actually very standard. It's not unusual. It's nothing to be concerned about. But you do then would need to sign that and participate in order to be part of this multi-step process. So the first step of the process is to recognize the need for the accommodation. The second is to gather the information necessary. So that medical documentation, usually it's your human resource department and not your direct supervisor who's managing that. The third step is to explore options about what might make you be able to do this job. The fourth step is to choose those accommodations. And then the fifth and sixth step are to implement and monitor those accommodations. And you notice I put that arrow over there. That can be a very repetitive kind of process, either because the accommodation didn't work or your condition has changed and now you need a different accommodation. In order to qualify for job accommodations, you have to be under medical care, and the care you need, the condition you have must be disabling. So it's helpful for you to let your physician, your care team know what's happening at work and be honest about that, maybe have other people's observations as well, and to document that in your medical record. That will help not only with the accommodations process, but could also be really helpful later when you're past accommodations and you're looking at disability. So here's questions to consider as you're thinking about limitations in the context of work. So what limitations are you experiencing? How do these limitations affect your ability to do your job? Look at those essential tasks of your job and see which ones you're struggling with, how they're affected by your limitations. So really think about not only reading your job description, but I don't know about any of you, I do so many more things than my job description ever even says. Like I always say, other duties as assigned is at the top. So, not only look at the job description, but think about the daily tasks that you do and really itemize those and analyze those. Think about what accommodations you could think of that might reduce or eliminate those issues, or what might make it easier. Do you need more breaks? Do you need more time to complete a task? Maybe can you get by with fewer tasks? And you can create a list of accommodations for yourself, but you don't necessarily want to depend on someone else to tell you what you need, but you might actually want to engage some other people in this kind of pre-work. Your care partner, a trusted coworker, perhaps a supervisor if that person is particularly compassionate about what's going on. You might need their external observation to really know about what you might be struggling with, because you might not be able to see it. So I mentioned the Job Accommodation Network. This is a really wonderful resource. Their website is at the end, and there's a resource list, but it's askjan.org. This is a free resource, and they have very specific hints and tips and technical information about the ADA. What I have up here are their Huntington's disease specific information. So they list, what is your accommodation, and then you can click on that and you can see some ideas of some accommodations that you might need based upon those limitations. And then they also have a similar list where the drop down by job function. So if you say, I'm having trouble with some short-term memory, what accommodations might I need, what might help me with that? You can click on memory loss and it'll give you things about, schedulers and reminders and, just different very practical tips. I really like the practicalness of it. Or if you say, my workstation is just not accessible. I'm using, a walker now and the hallways are narrow and they have boxes piled up to the ceiling and I can't get in there. That's a fairly easy accommodation probably to take care of. But you can click on that and they can give you some ideas. So this is just a sampling. There's a ton of really great resources out there for you for free. So some potential accommodations would be maybe assistance from others in performing aspects of your job. This is a big maybe. They don't have to have another employee have to do more work to accommodate you, but there may be some aspects where that would work. Special equipment, for a lot of people I work with, flexible work hours, or being able to take a day off if it's a particularly bad day, extra breaks, maybe working at off times so there's less distraction in the office. Those kinds of things can be very helpful to people. So what if you're having problems? So I mentioned that the Equal Opportunity Employment Commission, so the EEOC, they're charged with, the enforcement of these laws. And so first, though, if you're afraid to ask for accommodations, what do? Well, if you sit back and wait for the employer to notice, you might be waiting too long. So you really probably should try to find a way to begin that conversation. You really do need to share that information about your need for accommodations and participate in that interactive process. You are the expert in HD. You are the expert in your needs. No one else is. Did you have a question?
Yeah, tell them you have HD, or you just say you need an accommodation. I mean, how far into it do you have to go?
I think ultimately you'll have to tell them, right? Would you say, Allison? The question, in case the live stream couldn't hear it, was do you have to actually say the words Huntington's disease?
You do not have to say the words Huntington's disease, but it can be hard. There are other ways to describe it, but sometimes if you don't
Yeah. So
it's a gray area, because sometimes you can say enough based on what you're experiencing that you don't have to list your full diagnosis, but sometimes it can be hard to get around it. Sometimes you can work with your provider to find what phrasing works for you at that time, but as all legal answers, it always
It depends. So he's going to bring you a mic, but I'll repeat that for the sake of time. She's basically saying it depends. You don't have to use the word HD, but sometimes it can be hard to get to the nut of what you actually need without saying that. So you could start by trying to say, I have a neurodegenerative disease and I have these needs. Yes?
So in my
Can you use that?
In my experience, that most people end up having to disclose that information specifically because otherwise the vagueness of it, there's a much more understanding and much more willingness to help, I think, if they understand what's going on. And if we're vague with our descriptive medical terms, they kind of don't know what that stuff means anyway, so it helps them to be able to frankly Google it and just introduce themselves to HD if they're unfamiliar with it. But that does mean that most people end up disclosing.
Yeah, it's hard because a lot of people don't want to cross that line in the sand, and I do understand that. But you have to remember that disclosure brings with it legal protection as well. So if you try to be vague or if you try not to tell them enough, you may not actually get the full legal protection that you're due. So, okay. So if you think your rights have been violated, start small. You can go to HR. I often encourage people to do this all in writing, send emails, blind copy those emails to your personal email so that you have a record of those in case you are suddenly gone and don't have access to your work email. You can have verbal communication, but if you do, I would send a summary follow-up, just again for tracking purposes. And if this really goes bad and you feel like you need to take this to a bigger level, you can contact the EEOC. There are some limitations on how long you have to do that. You have 180 days to file the claim. This is a situation where you really would want legal representation, I think. It's very important to know, I said this once before, that with HD there does come a point when no level of accommodation will allow you to retain that work. So these protections work up to that point when no accommodation will help. So let's do a job accommodation case study or two. This actually comes directly from the Job Accommodation Network. I stole it from them. So a accounts collector had trouble with concentration because of HD. And so the Job Accommodation Network made some suggestions, moving the cubicle closer to, or away from noise or whatever, but relocation of their cubicle, extending the height of the cubicle walls for distraction and noise purposes, maybe using noise-canceling headphones, maybe shifting their start and end time of their day so that there's, less people around. Maybe designating a time when they were allowed to turn off their phones so that they could have some some time that's not broken up, I guess. And I'm also permitting them to work from home. So that's a great list of accommodations. For Bob, he had worked at a company for a good long time. He had always been a great employee. He was on time, met all of his job expectations, but his boss started to notice that he was tardy and he wasn't really completing his work in the way that he used to, and Bob never brought it up. The employer can initiate a conversation with Bob, and hopefully would, so they can make note of the tardiness and say, this isn't you, this isn't what we've seen for the last 10 years you've worked here, and the supervisors can say, is there anything we can do to help you with this? So they can recognize this as a consequence of a medical need. And so the employer can connect them with human resources and with other resources for perhaps some leave or perhaps some job accommodations. So let's talk about FMLA. Probably most of you have more familiarity with this than the other stuff, but this is the Family Medical Leave Act. This has been around for a long time now. This allows folks up to 12 weeks of leave per year. That leave does not need to be paid and it does not need to be continuous. So it can be intermittent leave. While somebody is on this leave, they do retain their medical insurance through their job, and they're entitled to return to that job or something equivalent to that job. This applies to most employees in this country, but if you work for a very small company, it may not apply to you. And you have to have worked there at least a month. And within that, 12 months, 1 year, at least 1 year. And within that year, you have to have worked at least 1,250 hours, which is just over 31 weeks. So for a part-time employee, you may have trouble meeting that rule, depending on how part-time you are. While the leave is considered unpaid, the company can require you to use sick time, vacation time, other forms of paid leave as a part of that 12 weeks of leave. So what are the qualifying conditions? The ones for us are really the middle, the second and third. So if you have a child or a foster child or an adoptive child, you can have leave for care and bonding with that child. For our purposes, the next two are more important. So care for an immediate family member. How do they define immediate family member? Spouse, child, parent. Not your parent-in-law, not your sibling, unless you are caring for that sibling in the absence of a parental, in sort of a parental role. So in loco parentis, they call that. So if that sibling is young or is 18 and older with a disability, they may grant you leave under that. Companies can always do better than the law. They can't do worse. So maybe your company would allow you to care for your in-law, but they don't have to under the law. It can also apply for your own health condition, of course. And so what do they consider that? A serious health condition that requires you to be in the hospital, requires you to be under the care of a medical professional, have ongoing treatment. So I'm gonna give you an example. I had a young woman recently come to the clinic. She wanted to have a preliminary discussion about pre-symptomatic testing. So pre-symptomatic testing, she was a healthy person, and her mom came along with her for support and to get more information as well. Her mom put in a day off request at work to do that. Her mom's company requested that she apply for FMLA for that day off work. Does that make sense? Tell me some reasons why that does not make sense. You're right, but why? Tell me why. Right, she wasn't sick. She hadn't been in the hospital. This wasn't a lengthy thing. This was a one-time conversation. Yeah, that was really the primary reason why that didn't make any sense. And she wasn't providing care to her daughter either. She was just accompanying her for information and support. So that was my response. I'll write a letter that you were here if they need proof that you were in the office, but it's not an FMLA request. Okay. So let's talk a little bit about intermittent leave. I see this come up the most in our office, and frankly, the forms are difficult. I think whoever invented these forms at the Department of Labor or whoever it is probably envisioned somebody who had cancer and was going through cancer treatments when they figured out these forms for us to fill out. Because we are asked to decide how often are you going to need to be off, how many hours at a time over the course of this period of time. And that doesn't fit in the nice little box with HD. So there's a lot of guesswork sometimes that go on with this. But intermittent leave is separate blocks of time, not continuous or some sort of reduced leave schedule. So working 4 hours a day rather than 8 or something like that. It is really important to try to do this in a way that doesn't interrupt your employer's operations. So if you know that you have a doctor's appointment 3 months from now, maybe tell them 3 months from now. Don't wait until the day before and say, I'm taking an FMLA day. That's really not the way you should proceed with that. During the FMLA and intermittent leave, you can be moved to an alternate job, but it has to have the same pay, offer you the same benefits, or better. And then when you return, you should be able to return to your equivalent job or something equivalent to it. That's all I want to say about that. More on intermittent leave. You are required, when possible, which is an interesting way of saying things, to give advance notice, so 30 days. This is not always possible, and we know that. You do have to provide sufficient information for the reason you're taking off. So you can't just call up and be like, yeah, it's FMLA day, or I don't feel like coming in, or I need a mental health day. You really need to say, I wasn't able to sleep last night, my insomnia was really bad, or whatever it might be. So you still have to comply with whatever your normal call-in procedures are for your company for leave. So let's give you a case study on FMLA. So we're talking about John. His mom has advanced HD, and he shares caregiving duties with his sister, but also with some hired caregivers. And so he put in for intermittent FMLA so that he could do his portion of the caregiving time with his mom. Shortly after he filed this FMLA paperwork, he was terminated. This is very clearly a potential GINA and FMLA violation. Would require a little more looking, but it seems a bit suspicious to me. Sally has worked at her company for 5 years as a receptionist. She put in FMLA to go to physical therapy appointments, which were ordered by her neurologist. She would have this once a week for about 2 months, and she has plenty of sick time. Her employer requested that she put in an FMLA request. Does that make sense? So I think I heard a no. Does anybody think yes? It is an appropriate request. Yeah. So the leave would still be paid under sick time, but it can count towards those 12 weeks of FMLA as intermittent leave. So it's not an inappropriate request. It seems silly. Some companies did it during COVID, like you have COVID, you can't come in for 5 days, and now you have to go through like our, Unum or something. It's a lot of extra work, but it is appropriate for them to do that. So I think I pretty much covered that one. So what can my employer know? So they usually will require documentation from your healthcare providers. They have a right to know why you're not going to be there and why you can't, what essential functions you can't do because of your illness. They have a right to know if you've previously taken leave for this reason and when you expect to be back. So I recently sat in on a manager training at work, and so this is what really prompted me to put these slides in, because it wasn't something I'd really thought much about before, but it was really talking about using leave as accommodations, so under the ADA. And so when might leave be an accommodation? Maybe there's no other effective accommodation. So with a break, a leave of some kind, you would be able to return to doing that job as before. Maybe it's an employee who's not FMLA eligible, which could be because they've used up their FMLA, or they haven't worked there a year, or they're part-time and haven't had the hour requirements in, something like that. That would also be potentially an accommodation for leave. Leave can be accrued paid sick time, vacation, other things you have in the bank, but it can also be unpaid. There's some states that have additional, the state I'm in doesn't, but there are some states that have additional medical leave laws, so you may want to ask your local HDSA social worker or COE social worker or somebody else like that if there's something like that in your particular area. Can you work and receive disability? You can. Social Security is not going to tell you you cannot work, but they do have limitations on how much you're allowed to earn. There is an amount called Substantial Gainful Activity, or SGA. This is an amount that changes every year, and this is the amount at which if you make 1 penny over it, you're not disabled. And so in 2024, that's $1,550. That is a gross amount. So that's not the amount you have to play with at the end of the month. That's the amount before they take out all your taxes. If somebody is blind, there is a higher amount. So there are several work incentive programs to help people who want to try to work but are receiving disability benefits. These can often protect things like your Medicare or allow you to buy into Medicaid. They're very complex, and I'm not going to go into them because we don't have time, and it actually affects a very small number of people. But they're important to sort of know about and inquire about if you think that these might be relevant for you. All right. I was telling Allison that last night I realized I did not have a slide about vocational rehab, so this was added at 11 o'clock last night. I've been a social worker working in HD for a really long time. I've never had anybody work with voc rehab, which is, I don't know, maybe I'm not doing something right, or maybe it just doesn't seem to work out, or maybe it's my state, I don't know. But anyway, you should know about it because there might be some services that could help you. So this is a state level agency that helps those with individuals with disabilities have tools and resources and education and support to be able to work. And so I actually pulled this list from Washington State's voc rehab site, but I think it's probably fairly consistent across the country. So they provide vocational rehab counselors who provide guidance and education and help with decision making and knowing the resources available to them. They will do assessments, and so those assessments can be, what are your limitations, what are your strengths, what are your skills and interests, so that you're not placed in a job that you're, like, don't give me a job where I have to do math, like that would be a terrible idea. So, you could do those sort of skill assessments. They can also help with benefit planning, so they're the ones who could really help with those Ticket to Work and those other work incentive programs. They're gonna know that better than me. Maybe some of the HD social workers know it better than me, that's quite possible, but these guys would really be your experts in that. So they could explain how work could impact your SSDI, your Social Security Disability Insurance, or your SSI if you're on the need-based one. or again, how to utilize those work incentive programs. So they would really be your experts. They can also help with practical things with independent living. So how to follow a schedule to get to work on time, or manage your funds, or how to use public transportation to get to work when you're no longer driving. So very practical kinds of things. They can also assist with assessment and access to different kinds of assistive technology. So if you are having trouble with your speech being understood, maybe they can work with some augmented speech devices or mobility devices or things like this, or adaptive, workstation type things if you have a job that's largely on the computer. And they can train you in all of these skills. They can also work with you on getting training for a different job. If there's a certification that you need to go into IT or something, perhaps that training could be provided through Voc Rehab. They can help with just the practicalities of giving a job, how to write a resume, doing practice interviews, helping with application completion, stuff like that. So they offer a broad range of resources, which makes me question why I'm not using them more. So maybe I'll chat with some of my fellow social workers and see what I'm missing. All right. So how can your care team support you? Your physician is a key player in this because their documentation is very important. You have to be under their medical care to qualify for most of these things that I've spoken about, and you'll need to provide that documentation. So very key that you let them know very honestly what's going on so they can document that. Your social worker is, kind of your go-to person to understand these things, and if we don't know it, we'll find out. That's like the motto of every social worker. If I don't know, I'll find out. And so we'll help you navigate these options and get your resources and maybe help you get your documentation and that kind of thing. If you haven't had it, it might be very helpful to have neuropsychological testing if you're somebody who's having cognitive deficits that are impairing your work. That can establish the extent and the type of cognitive deficits you're having, and then maybe you would have some better ideas of how to work with those deficits to make a plan for an accommodation. And your occupational therapist is really golden in these kind of situations. So occupational therapists work with lots of things. People often get confused that occupational therapy only deals with employment. Here's a situation where I'm actually talking about employment versus all the other things they do. But they can work with you on strategies in all of the domains that affect you with HD. So the cognitive aspects or the motor implications or any kind of emotional or behavioral things that impair work. So this talk was primarily about working on the job with HD, but I would be remiss if I didn't touch at least a little bit on what to do when working is no longer possible. I cannot emphasize enough, you don't want to get fired. Because if you get fired, you're going to lose access to short-term disability and long-term disability and maybe unused sick time or vacation or whatever the policies of your company. So what options do you have if you're getting to that point? So Allison and I have had an extensive discussion about the first bullet point, which is try a step-down job. So what I mean by step-down job is maybe something that's a little bit easier than what you're doing or just different, and therefore you could be successful. This is not a risk-free approach. Your Social Security disability benefits are based upon some historical work history calculations. So if you take a step-down job that is too far down and you take a huge reduction in your income, it could affect your disability benefits later. But on the flip side of that, it might still be paying better than disability would be paying, right? It might keep you with medical insurance, where if you go on Social Security disability, you're not going to get Medicare for 2 years. So that was my 10-minute warning. I think we're good. So, you'll want to weigh those risks and benefits. And then there's the kind of not real practical, obvious things to think about. What is the emotional benefit, the social benefit of working? That has value too. And so sometimes when people go on disability and, they don't have the stress of work, sometimes life gets better. Sometimes for other people, life gets worse. They're a little bit lost. They don't know what to do with their time and, become too couch potato-y, and, that has its disadvantages as well. For some people, they say, well, I'm just going to retire early. Well, what's that mean? What's early? You can get Social Security retirement benefits at 62, but you're going to get paid a whole lot less. So if you're actually disabled, you're not going to really want to go that route. I've had some people go that route while they're applying for disability. That's a little bit more complex than I'm going to deal with now. The advantage of retiring is you don't have to medically qualify for that, but it is a highly reduced monthly benefit. So it's a pretty risky thing to do. You can apply for company disability, short-term, long-term, and when should you do that? Really as soon as those symptoms impact your ability to perform work and your activities of daily living. If you're no longer earning at that SGA that I talked about, so $15.50 a month this year, if you're under that, you should go ahead and apply. And so you should contact HR if you're interested in applying for your employer-related disability benefits. So here's a case study on work cessation. So a nurse who has HD worked for many years and then began having motor symptoms, which impacted her ability to give injections and draw blood and other physical aspects of her job. So she did a step-down job, but for her, it was a step down and really into a different role. It wasn't so much a step down as maybe a step over. And so she applied for a different job. She was mostly doing chart review, really not dealing with patients, but dealing with quality control and that kind of thing. And that allowed her to successfully work for much longer. And then she started to develop more cognitive impairment, so she was not able to do that as well. So this was the point at which she applied for short-term disability and started her Social Security disability application. So social work wisdom. What things have I seen over nearly 18 years of working with the HD population? People wait too long. By the time they're finally ready for accommodations, they should have had them probably years ago, or at least months ago. And sometimes it really is too late to come up with an accommodation that allows them to be successful. So don't wait too long. These accommodations, this is a law that is available to you, it is a benefit to you, try to use them. Financially, working is usually better than not working. So it is okay to consider that step-down job, but you will really want to sit down and run the math and run the social aspects and have a really honest conversation about that. But often you're going to make more working. Definitely maximize your benefits. It kind of surprises me still how many people say, well, my employer gives us short-term disability, but if we want long-term disability, we have to pay $10 a month. That sounds cheap to me for lots of money. So what is that? Did you have something to say? Oh, she was agreeing.
I was agreeing with you
that was
because it's so
emphatic.
upsetting when people are like, oh no, I don't have it. Why? I'm going to come smack you. I'm not supposed to, but like.
Yeah. There's so much control you don't have with insurance when you're looking at HD. This is one where you have one up on them, right? They have to offer you these benefits, and if you don't sign up for them, why not? It's a coffee a month or something, or it probably is worth it. So do maximize those benefits. Or if you're looking at a job and you have two offers and one pays a little bit less, but the benefits are better, think about it. Do a full analysis of all that. If you are self-employed, pay into the system. This is FICA. This is your Medicare and Social Security tax on your check. I'm not Uncle Sam. I mostly don't care if you pay your taxes, but this is a situation where paying your taxes will help you. I'm working with a young man right now who has not done that. I consulted with Allison on this case. He has not paid into FICA for enough years that he is no longer eligible for Social Security, and he is now in need of Social Security disability. So his options are very limited. If you're fired, you're going to lose access to those benefits. Is that the third or fourth time I've said that? If that happens, try telling them, hey, you know what? I actually have a disability. This is completely backwards. This is not the plan you should do. You shouldn't say, I'm going to keep this under wraps, and once they fire me, I'll tell them, don't fire me, I'm actually disabled. But the only reason I added it to the list is I have seen it work. Yes, ma'am. Okay, 5. Yeah, we're about done. Okay, so yeah, it's a completely backwards. You don't want to plan for this, but it's worth trying. I've had it happen twice, and they reinstated the person and then allowed them to apply for disability, and it was beautiful that it worked for those folks. Work with occupational therapy. As I mentioned, socially and financially, I do see as a social worker that usually people do better working than not working. Emotionally, though, it's a toss-up. Some people are giving their all at the office. They have nothing left. That's a disadvantage. So you want to think about those quality of life factors that may make it not worth it to keep trying so very hard to keep working. Remember that you are the expert on your HD or your family member's HD, and not only your HD, but probably HD in general. And as we've said a couple of times, with HD, there does come a point where job accommodations aren't going to help you. And as most of you in this room know, that unawareness, known as anosognosia, this really contributes a lot to job issues where folks don't realize that they're struggling on the job, so they don't mention it, they don't see it, and so sometimes they're fired even when they shouldn't be, but they're not aware. So that's a hard problem. This one already came up, but disclosing your diagnosis. People do fear talking about HD in the workplace, but you do have a lot more legal protections than before, and once you disclose it, they should be a little more scared about just up and firing you. But if you want protections under the law, you have to disclose. There's just really not a great way otherwise to get those things you need. So I didn't leave a ton of time for questions. There's resources. I gave it on the handout. Many of these resources come directly from Allison. She's put them out there and they're fantastic. And some come from the government. And then references for my presentation. So questions from anybody while we have, yes? Can you use the mic? Otherwise, if you're not comfortable, I'll repeat it.
Are there any legal protections for individuals that work for very small employers, like less than 10? Or is it only apply to bigger?
I mean, maybe some state ones.
Iowa.
I know in Ohio, so like if
So Ohio is the state she's asking about.
Sure.
Oh, Iowa, okay.
Sure.
in Ohio, I think it's 4 or more or 6 or more, so you have to look at your state. So
Okay.
I said that as an example because there are states
Yeah.
that have laws that go down to 4 people.
Yeah, the federal ones, though, none of them are that low, I think,
Right.
unfortunately. But employers can do better than they're required to do.
Yeah. That's,
They can.
I
Doesn't mean they
recently
will.
had to sign a sheet that said we didn't qualify for FMLA, but I had a conversation with our administrator saying, but you can do all of these things, if you want to. But
Yeah. Yeah, sorry, that's that small employers really, it's more of a hardship for them, and that's why they have those rules. Yeah. Anybody else? Great. Well, thank you so much for your time and attention.